Surgical eyeless needles are manufactured in a wide range of types, shapes, lengths and thicknesses. The choice of needle to be used must rest with the surgeon and may take into account several factors, such as the requirements of the specific procedure, the nature of the tissue to be sutured, the accessibility of the operative area, and the preferred techniques of each individual surgeon. The choice of needle shape is frequently governed by the accessibility of the tissue to be sutured, and normally the more confined the operative site, the greater the curvature required. The point profile of round-bodied needles is engineered to provide easy penetration of tissues. A flattened area is provided halfway between the point and the suture attachment. Positioning the needle holder in this area confers extra stability on the needle being held. The blunt taper point needle has been designed to minimize the risk of needle stick injury. The needle point is sharp enough to penetrate fascia and muscle, but not skin. This virtually eliminates accidental glove puncture. The taper cut needle combines the initial penetration of a cutting needle with the minimal trauma of a round-bodied needle. The cutting tip is limited to the point of the needle, which then tapers out to merge smoothly into a round cross-section. The conventional cutting needle has a triangular cross-section with the apex of the triangle on the inside of the needle curvature. The effective cutting edges are restricted to the front section of the needle and merge into a triangulated body which continues for half its length. The body of the reverse cutting needle is also triangular in cross-section, but has the apical cutting edge on the outside of the needle curvature. This improves the strength of the needle and particularly increases its resistance to bending. The final decision on the choice of the most suitable suture material and needle combination rests on the careful consideration of a number of essential factors. The operation, access and the type of tissue being approximated will determine the needle choice and the size of suture gauge to be selected. The tissues and their wound healing requirements will determine the choice of suture for any particular operative procedure. Other patient-related factors that may result in potential wound healing complications will further influence the choice of suture material.